there was a data breach at the Bureau of Vital Records that halted the issuance of birth certificates. Can you tell us how long it takes now for a person to receive a birth certificate?
Thank you for that question. We have been
You're
waiting
welcome.
for that question. First, I'll defer to the Office of Administration, which handles all of IT for the administration. I don't think that they're calling it a data breach. I think it was a attempt, and everything was safeguarded. So I'll leave it to the Office of Administration in terms of how they are specifically characterizing that. But we discussed last year that there was a 4-point plan to improve the efficiency of the Vital Records Department for birth certificates and death certificates. The 4-point plan was first a move to a much more advanced, efficient building in the Newcastle area down the street, and that was accomplished. The second was lean training in terms of efficiencies. We actually had Toyota, who is the founder of lean, the company, come to do lean training to increase efficiencies. The third aspect is almost done, and that's a procurement of a contract for a new IT vendor. And the fourth, and thank you all, was $2.35 million to be able to hire people to be able to keep up with the changes, particularly in birth certificates, but both in birth and death certificates, especially with the Real ID Act, and I gather they're available today. So this is not going to go away for us. We have decreased by 35 weeks the wait for birth certificates, and we actually have a poster for you to show the decrease. Can you show us the poster?
You have been waiting.
So you can see that for male birth, online, male death, online birth, everything, it's now down to approximately 1 to 2 weeks. And so this is a testament to our staff, to all of the changes we've made, and to you all for giving us the resources to fix this problem.
Well, thank you, and that's very good news, because I know it causes great consternation in our district offices when people
Absolutely.
can't receive those in a timely fashion.
In fact, right now, we have someone from Vital Records in our office on the 8th floor working with the legislative branch so that we have a specific person hired with the funding that you gave us to handle any problems that you all might have from your constituents.
Thank you very much. A few other quick questions. PBMs, I'm sure you are familiar with the work that the Auditor General has done and some of the legislation that has been percolating through the legislature. What I can tell you is West Virginia found a savings of $30 million per quarter when they moved from spread pricing to pass-through pricing with their pharmacy benefit managers. Ohio found they were overcharged $245 million because of spread pricing. New York proved that spread pricing cost them about $300 million. So what is Pennsylvania doing to stop spread pricing, and how much money do you believe we can save the Commonwealth? In large part because these are dollars that are serving some of our most vulnerable and neediest Pennsylvanians.
Thank you. Do you want to say a little So that's really for the actually Department of Human Services and the Department of Insurance. It's not run through the Department of Health. Now, Ronnie, as I mentioned, is the budget director for all 4 agencies, so she might be able to comment. But I know Secretary Miller is coming this afternoon, so she would be able to better respond. But
Yeah,
Ronnie
you may want to hold that question till this afternoon if that's okay with you.
I will certainly do that. And then lastly, you know, we've had now, what, 5 disaster declarations or not disaster declarations, but yeah, disaster declarations, right? So we're on our 5th. Prior to the first one being issued, I had emergency service providers come to me and say that the Department of Health had halted their ability to leave naloxone behind to a caregiver. And that was really problematic in the rural parts of York County because many people don't want to take that 40-minute ride to York, where that warm handoff is at Wellspan. So we know that these disaster declarations are not going to go on in perpetuity. And so I would say, you know, this is something I think that we need to codify, to fix, so that our emergency service providers have the ability to continue to leave behind a dose of naloxone if they can't get that person into a warm handoff, right? We know we want them to go into treatment, but we have to keep them alive in order to get them into treatment. So I would say to you, I know that earlier on, you mentioned that these were going to go on basically indefinitely. But I have to believe we can't continue to do this, that if we see this need, we should probably codify the things that we are receiving under that disaster declaration to deal with this crisis. Can you talk about, would you be supportive of that, one? And two, are there any other things that we need to permanently codify in anticipation that we're not going to be able to declare disaster declarations in perpetuity?
So the naloxone program, again, starting with Act 139 and moving forward, has been extremely successful. Since 2016, law enforcement has over 7,000 reversals. EMS in 2018 had 17,869 reversals total, and using the funding that through PCCD previously have over 6,000 reversals. I did revise the standing order with the disaster declaration, and we have left behind over 600 doses of naloxone in the last year. I would be pleased to discuss codifying that as opposed to having it just be part of a standing order about naloxone leave behind. I think that the key is to get people into treatment, but not everybody does. I would like to point out that EMS has between 85 and 90% success rate in terms of getting people to go from their homes to the emergency department. So the idea that most people stay home is not true. Actually, it has ebbed and flowed, but in some areas it's actually more than 90% are actually successfully transported. But for those who don't, I think leaving behind naloxone is really important. One thing that I have discussed in the past is in terms of the implementation of the standing order for the public, meaning for the public to go to a pharmacy, is that the Act 139 allowed me to write that standing order so everyone can use my prescription, essentially as the state health official, but it doesn't cover the insurance. And so when I went to my pharmacy to get naloxone, so I carry it in my purse in case anywhere I am, someone might overdose, I can revive them. What I was asked is, who's it for? Now, they really shouldn't ask me that because it shouldn't make any difference who it's for. It's covered by our insurance, but that's what they do, especially the pharmacy assistants. And so if I said this is for potentially my son, my daughter, my partner, my nephew, then our commercial insurance, it's potentially fraud for me to pay for it, right? So that bridge could be, and we can describe it more if I'm not being clear, that Medicaid will pay for it no matter who has Medicaid, but commercial insurance, they consider it fraud if I'm buying naloxone to be used for a relative. So, and in terms of my insurance paying for it. So that fix would be, to Act 139 as an amendment, would be really, really helpful. To try to counter any concerns, actually in December, we had Naloxone Day, where through our state health centers and also community health centers in Philadelphia and Pittsburgh, we gave out over 6,100 kits of naloxone. Over 6,100, and each kit has 2 doses. To the public, anybody who came in could get a kit of naloxone, because we want, the Surgeon General of the United States, Dr. Jerome Adams, says that everybody's a potential first responder. We want everyone to have access to naloxone.